My horse has always had a lazy hind limb. Well, surely a lazy hind limb, a limb that is constantly toe dragging, is a lame limb. I would draw your attention to this document produced in association with World Horse Welfare, a document called Mythbusters, which addresses many of these problems that are perceived to be normal for horses, but in fact have generally underlying pain-related causation. Many horses are lame on more than one limb, and therefore will appear less lame than if they were only lame on a single limb. And horses, being prey animals, adapt their movement to minimize pain, to minimize the display of their compromising gait. Many horses are presented for investigation of reduced performance rather than lameness. The owner's assumption of when a problem first arose is often inaccurate, and careful review of the history often reveals a much more long-standing problem. Lack of hind limb impulsion and engagement is often missed, as is a bilateral hind limb toe drag, as observed in the horse here. Many horses with chronic lameness do not have localizing clinical signs. However, they adapt to the lameness by reducing the range of motion of the thoracolumbar-sacral region. And this has consequences. It results in atrophy of the epaxial muscles, with often the development of some degree of hypertonicity, with or without pain on palpation. And if the horse has got a bilateral hind limb problem, and the problem is slightly more severe on one side than the other, often the hypertonicity and pain is greater ipsilateral or on the same side as the lamer limb.